The fluorescent lights of St. Michael's Veterans Hospital hummed their endless monotone song, casting sterile white light across corridors that had witnessed countless stories of sacrifice and survival. In Ward 7, where the most critically wounded soldiers recovered from injuries sustained in combat zones across the globe, the atmosphere carried a weight that went beyond the antiseptic smell and the rhythmic beeping of medical monitors. Among the dedicated staff who moved through these halls with practiced efficiency, one figure stood out precisely because she tried so hard not to. Nurse Sarah Mitchell was a study in understated competence. Her graying hair pulled back in a simple bun, her scrubs always crisp but never flashy, her movements economical and purposeful. She had worked at St. Michael's for nearly 3 years, and in that time she had become known for two things: her exceptional skill with the most difficult patients, and her extraordinary quietness about anything personal. "She's like a ghost," Dr. Raymond Parker had once remarked to a colleague. "Competent as hell, but you'd never know anything about her if you didn't work alongside her every day. Even then, you'd barely scratch the surface." It was true. While other nurses chatted about their families during breaks, shared photos of their children, or complained about their spouses, Sarah listened with a gentle smile but contributed nothing. When asked direct questions about her background, she deflected with such practiced grace that people often didn't realize they'd received no real answer until much later. The hospital administrators knew only what her employment file revealed: impeccable credentials, a nursing degree from a prestigious university, years of experience in trauma care, and references that praised her abilities in terms that bordered on reverent. But there were gaps in her resume, years unaccounted for, explained away with vague mentions of government service that no one thought to question too deeply. On a humid Tuesday morning in late August, everything changed. The emergency call had come in at 0400 hours, multiple casualties incoming from a training accident at Fort Bragg. The hospital mobilized with the efficiency born of too much practice, and by the time the ambulances screamed into the bay, trauma teams were ready. Captain Marcus Chen was the worst of them. The 29-year-old Army Ranger had been leading a high-altitude insertion exercise when equipment failure had sent him plummeting 40 feet onto unforgiving ground. Multiple fractures, internal bleeding, severe head trauma, the kind of injuries that defined the razor's edge between survival and tragedy. Sarah had been assigned to his post-operative care, and for 3 days she maintained her vigil with the same quiet intensity she brought to every patient. She monitored his vitals, adjusted his medications, spoke softly to him during the long hours when he drifted in medically induced twilight, neither fully conscious nor completely absent. Dr. Parker, who had performed the marathon surgery that saved Chen's life, often found himself impressed by Sarah's intuitive understanding of their patient's needs. "It's like she can read him," he mentioned to the head nurse. "She knows when his pain is spiking before the monitors register it. She adjusts his position to prevent complications I wouldn't have thought to check for yet. It's uncanny." On the 4th day, Captain Chen began to emerge from sedation. Sarah was there, as she had been for most of his crucial hours, adjusting the flow of fluids through his IV when his eyes first flickered open with genuine awareness. "Easy," she said softly, her hand gentle on his shoulder. "You're safe. You're at St. Michael's Veterans Hospital. You were in an accident, but you're going to be okay." Chen's eyes struggled to focus, his mind fighting through the fog of medication and trauma. He tried to speak, but his throat was raw from intubation. "Don't try to talk yet," Sarah continued, her voice carrying a note of command so subtle that it registered more as comfort than instruction. "I'm going to raise your bed slightly. Blink once if the light is too bright." He blinked, and she dimmed the overhead lights with practiced efficiency. Over the next hour, she guided him through the disorientation of waking in a hospital bed, explaining his injuries in terms that were honest but not alarming, answering the questions his eyes asked before he could form the words. It was during this process that Dr. Parker entered with 2 other physicians for morning rounds. They clustered around Chen's chart at the foot of his bed, discussing his progress in the clinical shorthand of their profession. "Remarkable recovery for the severity of trauma," Dr. Parker noted. "The subdural hematoma resolved faster than expected, lung function improving. I think we can begin weaning him off the ventilator support by tomorrow if he continues this trajectory." The other doctors nodded, adding their observations, occasionally glancing at their patient but primarily focused on the data. This was the routine of hospital hierarchy. Doctors diagnosed and prescribed, nurses implemented and monitored. Everyone knew their place. Sarah stood quietly to the side, as she always did during rounds, her posture respectful but not subservient. She had already compiled her nursing notes, already flagged the slight elevation in white blood cell count that might indicate the beginning of infection, already adjusted his fluid intake to account for the fever she'd detected before the thermometer confirmed it. Captain Chen's eyes had been tracking between the doctors and Sarah, his mind still processing his surroundings with the careful assessment of someone trained to evaluate tactical situations. Despite his injuries, despite the medication clouding his thoughts, something was registering. His right arm was immobilized, but his left, though bruised and connected to multiple lines, had some mobility. As the doctors continued their discussion, Chen slowly, painfully, began to move that arm. Sarah noticed immediately. "Captain Chen, try not to move too much. You'll dislodge your—" But he wasn't trying to adjust his position. His arm was rising, trembling with effort, his hand moving toward his forehead in a gesture that every person who had ever worn a uniform would recognize instantly. He was saluting. Not the doctors. Not Dr. Parker, whose skill had saved his life. His eyes were locked on Sarah, and despite the pain that the movement clearly caused him, despite the confusion of nurses who rushed forward to try to ease his arm back down, he held the salute with the kind of rigid determination that spoke of military discipline so ingrained it transcended conscious thought. The room fell silent. The doctors stopped mid-sentence. The other nurses froze, uncertain. Sarah's face, usually so carefully composed, showed a flash of something that might have been resignation, or perhaps relief. She looked at Captain Chen, really looked at him, and then something shifted in her bearing. The gentle nurse who had stood quietly to the side seemed to straighten, to settle into a posture that spoke of authority so natural, it was like watching a mask fall away. She returned the salute with crisp precision, her movements carrying the muscle memory of thousands of repetitions. "At ease, Captain," she said quietly, and her voice carried a note of command that had never been present in her gentle bedside manner. Chen lowered his arm, but his eyes never left her face. "Colonel," he managed to rasp, and the single word dropped into the silent room like a stone into still water. "Doctor, Parker's expression cycled through confusion, disbelief, and dawning comprehension. "Colonel?" he repeated. Sarah, Colonel Mitchell apparently, let out a small sigh. She moved to Chen's side, checking his vitals with her usual efficiency. But when she spoke, it was with the weight of truth too long held silent. "Colonel Sarah Mitchell," she confirmed, her voice quiet but clear. "United States Army, retired. 26 years of service. Last posting, Chief of Trauma Surgery, Combat Support Hospital, Kandahar Province, Afghanistan." The words hung in the air like smoke after an explosion. Around the room, the staff stood frozen, recalibrating everything they thought they knew about the quiet nurse who had worked alongside them for 3 years. Dr. Parker found his voice first. "You're a surgeon? A military surgeon? A colonel?" "I was," Sarah corrected gently. "I'm a nurse now. That's the job I chose when I left the service." "But why—" One of the younger doctors started, then stopped, unsure how to even formulate the question. Chen, despite his condition, despite the pain he was clearly in, managed a weak smile. "Recognize the touch," he rasped. "The way you assessed injuries, moved with purpose, confidence. Seen it before. In the sandbox. Combat surgeons, different breed." Sarah's expression softened as she looked at him. "You should rest, Captain. Your body needs to heal." "With respect, ma'am," Chen persisted, his words slow but determined. "They should know what you gave up, what you've done." Over the following hours, as the news rippled through the hospital like wildfire through dry grass, the full story began to emerge. Not from Sarah herself, who remained as reticent as ever, but from the records that her revealed identity now made accessible, from the research that curious staff members conducted, from the calls that Dr. Parker made to contacts at Walter Reed and the Pentagon. Colonel Sarah Mitchell hadn't just been any military surgeon. She had been a legend. At 46, she had accumulated more combat theater experience than surgeons 20 years her senior. She had served in Iraq during the surge, in Afghanistan during the deadliest years of that conflict. She had performed surgery in field hospitals while mortar fire shook the walls, had worked 72-hour shifts during mass casualty events, had innovated trauma protocols that had been adopted across the entire military medical system. Her file was a litany of commendations: Bronze Stars, the Legion of Merit, the Combat Medical Badge. She had trained generations of combat surgeons, had published groundbreaking research on battlefield trauma care, had been on track to become Surgeon General of the Army. And then, 3 years ago, she had quietly retired, taken her pension, moved across the country, gotten a nursing degree through an accelerated program, and started working night shifts at a veterans hospital where no one knew her name. The question that everyone wanted answered was, why? Sarah refused interviews, declined the sudden deference that her revealed rank seemed to command, and continued working her shifts with the same quiet competence she had always shown. But she couldn't stop people from talking, couldn't prevent Captain Chen from sharing what he knew, couldn't control the narrative once it had escaped her careful containment. It was Chen himself who provided the answer, pieced together from brief conversations during his recovery, and from his own research into the woman who had cared for him. She lost her son, he told Dr. Parker one afternoon, his voice stronger now as healing progressed. Army Lieutenant, KIA in Helmand Province. She was the chief surgeon at the hospital where they brought him. She was the one who tried to save him. The weight of that revelation settled over everyone who heard it. Sarah had been the surgeon on duty when they brought in her own son, had worked to save him with the same skill she had brought to thousands of other wounded soldiers, and had failed for the first time in ways that mattered more than any previous success. After that, the pieces fell into place. Her retirement 6 months later, her choice to step down from surgery to nursing, her selection of a veterans hospital rather than a prestigious civilian practice, her dedication to the wounded soldiers who came through Ward 7. She was atoning, people whispered, or healing, or punishing herself, or honoring her son's memory by serving those who had served alongside him. Sarah herself never confirmed or denied any of these theories. When pressed by the hospital administrator who suggested that her surgical skills were being wasted, she simply said, "I'm exactly where I need to be, doing exactly what I need to do." But something did change after her secret was revealed. The quality of care in Ward 7 had always been excellent, but now it took on a different character. Young soldiers recovering from injuries found themselves receiving not just medical care, but mentorship from someone who understood their world in ways civilian medical staff could not. Sarah began, reluctantly at first, to share her knowledge more openly. She led training sessions on combat trauma care for the nursing staff. She consulted on difficult cases, offering insights drawn from decades of battlefield experience. She became a bridge between the military and civilian worlds, translating the unspoken needs of soldiers for the benefit of staff who had never worn a uniform. Captain Chen recovered, eventually, and before his transfer to a rehabilitation facility, he spent an afternoon with Sarah in the hospital's small garden. "I apologize if I caused you trouble," he said, with the salute. I couldn't let them not know. Not honor what you've done, what you've sacrificed." Sarah was quiet for a long moment, watching birds move through the trees. "I didn't want recognition," she said finally. "I wanted to be useful. Rank and reputation. They felt like obstacles to actually helping people. When you're Colonel Mitchell, the famous combat surgeon, people see the legend. When you're just Sarah, the night shift nurse, they see someone who's there to empty bedpans and check vitals. There's honesty in that. Humility. There's also truth in who you are," Chen countered gently. "Both things can exist. You can be humble and still let people benefit from your experience. You can serve without pretending you haven't already served in ways most people can't imagine." She smiled slightly. "When did you become so wise, Captain?" "I had a good nurse," he replied. In the months that followed, a new equilibrium established itself. Sarah Mitchell remained fundamentally the same person she had always been, quiet, competent, dedicated. But she stopped hiding, stopped deflecting every question about her past, stopped pretending that her experience meant nothing. She became, in her own way, even more effective. Young veterans found in her someone who understood their struggles from both sides, as a fellow soldier and as a parent who had lost a child to war. Other staff members found in her a teacher who could explain the invisible wounds of combat in ways that transformed their practice. Dr. Parker, who had initially felt somewhat foolish for not recognizing what had been working beside him all along, came to appreciate the strange gift that Sarah's anonymity had given the hospital. "She was testing us," he said to a colleague one day, "testing whether we would value her for her work or for her credentials. Whether we would listen to a nurse the same way we'd listen to a colonel and surgeon. We passed, mostly. But we also learned something about our own assumptions." The story of the quiet nurse whose secret was revealed by a wounded warrior's salute became one of those legends that hospitals tell themselves. A reminder about the hidden depths in ordinary people, about the difference between rank and worth, about the many ways that service can manifest. Sarah Mitchell continued her work in Ward 7, caring for the wounded soldiers who came through its doors with the same gentle competence she had always shown. But now, when young soldiers asked her if she understood what they were going through, she could answer honestly. "Yes," she would say simply. I understand. From more angles than you might think, and I'm here to help you through it, whatever it takes. And in the end, perhaps that was the real story. Not that a decorated colonel had been working as a nurse in secret, but that someone who had given everything to the military, including her only child, had found a way to keep serving with grace, humility, and an unwavering commitment to healing. The salute that Captain Chen had offered wasn't just recognition of rank. It was recognition of sacrifice, of dedication, of the quiet strength it takes to continue serving even when service has cost you everything you hold dear. Sarah Mitchell accepted it finally as what it was. Not a revelation of who she had been, but an acknowledgement of who she continued to be. A soldier, a surgeon, a nurse, a mother, and above all, a person committed to saving lives, no matter what form that service took. In Ward 7, under the fluorescent lights that hummed their endless song, that was more than enough.